was this ability to take the kids and bring them into nature, from rock climbing to camping to hiking and many other events that were outdoors. And what we truly know, and I think sometimes we forget, that one of the most important things that we can do to be a healthy society is to ground ourselves in nature in different ways. And the fact that Ray was able to do that for decades with the children of Ellington, amazing, just absolutely amazing, and is certainly worthy of recognition and is definitely a leadership quality. So Ray, on behalf of the Ellington Public Schools and certainly on behalf of the town of Ellington, we just want, this is a small token of our appreciation for you to take your wife Kathy and go over to Luann's and have a nice lunch. And if we can give Ray a nice round of applause.
So I'd like to thank you all very much for recognizing me, but in turn I'd like to recognize all of you, because as the adults, that without adults supporting the rescue post, it wouldn't happen. There was Sherwood Merck and Joan Sanger and Bob and Angie Sandberg and Pete Haney were all supportive of a group of teenagers that took on the responsibility of caring for individuals that would call. Back then, it was not a 911 call. It was 333.
They made it a little easier.
So it was a different system, but it was the same idea. And with the proper adult supervision, leadership, the teenagers that were in the school responded to this need for the community. And part of the importance of that was also developing a sense of community and giving back to your community. I think it's important for you to recognize that the kids in the school will respond to that. And they have new ideas. And sometimes it's hard for us old people to accept those ideas and let them go in their directions they need to go. So don't be afraid to trust them and support them. So thank you very much.
Well said, Ray. Thanks again, Ray, for everything that you do.
My sister was a. You both.
Oh, really? Ray, you have a.
My sister was a member of the rescue post. She graduated in '82, so she would have been there like '78 to '82. And it was like such a huge part of her high school, her development of everything.
There are, so many kids that were in the rescue post that have gone on to medical professional careers. So part of a lot of that is when you try to get accepted into different medical programs, you need to have so many hours of patient care. And so when my daughter was going to PA school, she was able to apply some of her time as an emergency medical technician to her patient care hours and stuff. So the program was phenomenal.
It's fantastic.
And
There were so many kids.
very important to so many kids.
And you're saving lives. Thank you. Thanks, Ray. Okay, citizens and staff forum. Dr. Nickel, Jen, any scheduled? No? Okay. Hearing none, we'll move on to the consent agenda. Is there a motion to approve the consent agenda, or would anyone like to pull anything to discussion? Is there a motion first?
Motion to approve the consent agenda as presented. Okay.
Seconded by Marcia. Any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed, say nay. Any abstentions? Passes. Next item, report and discussion items. Special reports, presentation and continued contact tracing process. Dr. Nichol. Hey, Patrice Zulik. Welcome, Patrice Zulik, our Director of Health, for the North Central District Health Department.
Really nice to be in person. So.
Yes,
Really is.
but socially distanced apart.
So, I appreciate it, Mr. Carl, and, I'd just like to say before I turn it over to Brian, is I don't think any of us, when you get into education, you get into running a school district or working for a school district. And certainly unless you're our fine nurses who are here that work in the health field, and thank you all for being here. You don't really think you're going to be learning about, how viruses, spread in a community and how you contact trace and like diving deep into health mitigation strategies. I know it's not something that I had ever thought about. And just to give you an idea, Brian Greenleaf, basically, he didn't know anything about this either, but guess what he can do? He reads and he learns, and then he can apply what he learns to the betterment of the school district. And he's done an amazing job working with all of the support staff, the nurses and other people throughout the district to really set up some really great parameters and contact tracing and things to kind of keep our schools open, but also ensure the safety of and health of all of our staff and students. And of course, we're also very pleased to have Patrice Zulik from the North Central Department Health District, who's been a partner with us, and she's just, I don't think she signed up for working 24/7 for the past, since March. So she has been around the clock working with all of the local school districts in the area, very supportive, very knowledgeable. We have a great working relationship, and we're very pleased that she's going to be here tonight to be able to answer some extra questions that you may have based on Brian Greenleaf's presentation. So with that said, I'll turn it over to Brian, and we can go from there.
Yeah, we're just going to pull up, give us a second here, we're going to pull up the presentation. You also have one in your packet. It's got a big Ellington Public Schools logo on the front. Here. Go. Sure. Working perfect. All right, so we've talked a lot about the mitigation strategies that are put in place, right? So we were talking about these plexiglass barriers that we're all sitting next to. We've talked about social distancing, which we're all practicing here. We've talked about wearing the masks. One thing we haven't really talked about as a group in great detail is the risk assessment and contact tracing, basically preparing for if somebody gets sick. And if you recall back to the plan that we presented to you and was approved in July, one of the main components, one of the main components of our mitigation strategies is preparing for when somebody gets sick. And so risk assessment and contact tracing are really the key components of that. And I'm going to kind of take you through the work that, as Scott said, we've been doing as a district, really led by our nurses who are here, but also in consultation with the North Central Health District. Before I get into that, though, I do want to touch on the other mitigation strategies that we put in place, just to kind of recap some things. So if we look at the state and public health data that's there, I know it's hard to see, so pull it up a little bit. The health data across the state, even though it's gone up over the past few weeks here, still ranks within what the state DPH has determined the low risk, low community transmission category. And it's fluctuated. I know we talked about it a few weeks ago at one of our workshops where it was trending up, and then it dipped back down within Pollock County. And so, we've been fairly fortunate there as we've transitioned back to the full in-person mode, that data has stayed low throughout our time in school. The other thing that's important to note is the other layers of mitigation that I talked about. It's early, but they appear to be working. right? And so on calls with the Department of Public Health, and, you know, Patrice is hearing the same calls we are, and maybe can speak to it a little bit. We're not seeing across the state widespread transmission of COVID within the school setting. So I don't know if you want to say anything
And
on your experience.
yes, that was very encouraging because when some of the communities in Connecticut started to see an increase, the State Department of Education and the Connecticut Department of Public Health cautioned them. They said, you know, these kind of general categories of if the case count, if the rolling averages, whatever, you should consider this. The reason they didn't want to make it a hard and fast rule is because every situation is a little bit different. And what they were seeing in some of those communities where there was very high case count and increasing is that those cases couldn't necessarily be tied to an at-school transmission. And I mean, not enough time has passed and there's not enough numbers to really do some hard study data about it. But what they're seeing is, and, you know, it's partly, I think, you know, and thanks to the adults, but I think it's a lot of the part is kids are a lot more resilient than maybe we expected them to be. And so they can get used to changes, most of them pretty quickly, but the mitigation is actually working. Now, it doesn't mean that there's no in-school transmission of cases, but generally with the data we have and the contact tracing we're doing, we're finding that there's not a lot of case transmission in school. We expect there to be some. It would be unreasonable to expect otherwise, but we're seeing a lot of case transmission out of schools. So for many communities in all 8 of health districts towns have, you know, are a little bit different in their profile, but for kids, school is probably the safest place for them to be. And if they're going to be maybe put with grandma or grandpa for the day every day, if there's no in-person school, then that's going to trigger potentially some other risks. Or if they're going to be wandering around in groups, going to parks, congregating, going to McDonald's, going to Dunkin' Donuts, then, you know, so closing schools seems to be the thing that people think of. Oddly, not closing sports, which is responsible for a significant illness transmission around amongst our young people in the community. But closing schools should be done thoughtfully, not reactively, not politically, not because people are stressed and freaking out, but if they're stressed and freaking out, we should bring them the information all of the information they need so that the community can make the best decision.
Yeah, and so, you know, that certainly jives with the small amount of evidence that we have. I'll talk about our, you know, kind of total numbers of cases and things like that in a minute, but, you know, what Patricia said, you know, we have seen as well. With that, just quick recognition. So I did want to recognize Patrice. I think Scott beat me to some of this at the beginning here. And I did want to also recognize the nurses. This has been, you know, they signed up to be a school nurse. They didn't sign up to be a public health nurse, dealing with this all the time. And we spent an inordinate amount of time going through this. So we have Stephanie and Andrea, Kelly, Lynn, Christy, and Danielle all with us here tonight. So I just want to publicly thank them for all of their hard work. And they're also certainly here to answer questions as well, as you may have them through the presentation.
Thank you.
Sorry. All right. So preparing for somebody, if somebody gets sick, kind of broke this down into kind of 4 elements here. Case identification, contact tracing, the risk assessment, and then isolation and quarantine. I'll go through each one. So case identification, like this is really where we spend a lot of time with the nurses. They're the ones on the front lines talking to families about what's going on with their kids, talking to staff about what's going on if they put in a sick day and don't give us the reason why. We're tracking all of those things. And I added it up today. We're close to 200 potential cases, right? So not actual cases, potential cases where people have gone and got tested that we've tracked throughout the beginning of the year. And that takes a lot of time and effort. We know that positivity rates in Connecticut are going up, but there's still, you know, 97% of people are testing negative. And so that's kind of, consistent with the data that we've seen, but it takes a lot of time and effort. And a lot of parents, get on the phone with them and say, why does my kid, who has the sniffles need to stay home and get a test? And they're the ones who are, holding the line and telling them that we treat all symptoms seriously. We have daily meetings between the nurses, myself, and other administrators to know that we're all on the same page and talk about any cases or potential cases that do come up. And we're also in constant contact with Patrice over here, daily if needed and weekly standings to make sure that we're all on the same page, including Saturday mornings sometimes, like it was this past week.
Or Sunday nights.
Yes. So in terms of the case identification, what are we looking for, right? So you have the full list of symptoms from the CDC there. Highlighted in blue, the ones that the State Department of Public Health has called out in their guidance as the highest risk. But as I kind of said before, we take all symptoms seriously. There is no such thing in the era of COVID as it's just a cold. That's an adjustment for people. It unfortunately means that kids have to stay out or staff have to stay out of the building longer while they're potentially waiting for a test. But we can't risk, having a transmission moment within the schools because we're not being vigilant. And some of the cases that we've seen have either been asymptomatic or very light symptoms, mild cases, where it has just been a congestion as the first symptom that shows up. And so, we are taking that seriously. And, as I said, that's an adjustment for parents. Sometimes they hear it from the parents and, they kind of hold that line for us, those nurses do. So what do we define as a case? What are the diagnostic tests? So I just wanted to kind of go through the kind of 3 different tests that are out there that you might hear about. So there's the RT-PCR, which is the gold standard. It's also called a molecular test. It's a nasal swab or oral that takes typically 2 days, but we're seeing as many as 4 to 6, depending on where you go to get a test. And that's the one that we will accept for all diagnoses. Rapid tests, we certainly have talked to people who've gone and got rapid tests or get both the rapid and the PCR, but we can't accept the rapid result as a negative anyway to come back into school. We need that PCR test. If there's a positive for the rapid test, we're going to treat that as a positive and act on that. And there's been cases where we've done that. Don't hear about it as much these days, but there's an antibody test or a serological test, which is really just, it's not for diagnostic. It's really to see if you've ever had COVID in the past. It's testing for the antibodies that are left behind after you've fought the infection. But we don't obviously accept those as a diagnosis. Right, and then, when that positive test comes up, and we've had a few, contact tracing is really the first step. And what contact tracing is, we're trying to find all the close contacts, which I'll show you the definition of in a second. We're not trying to map the whole network of people that you've ever been in touch with, all the way out to the 6th degree of separation with Kevin Bacon up there. We're really looking for that circle of people around the case that have spent the most time there. I call it, it's close contacts, first degree of separation, so that we can figure out who needs to be quarantined and isolated. Right, and what we do as we're doing this contact tracing is we have to look at an infectious period. And the infectious period begins either 2 days prior to symptom onset, or in the case of asymptomatic people, 2 days prior to the test being taken. And so that plays out differently in different cases, right? When we send out these communications to the community and we say, we look at all the factors of the case, we mean that because there are different times in infectious periods based on when those symptoms come up and when those symptoms or test is developed. So, here where you have a case of, the symptom onset on Friday, we would be looking at 3 days potentially within the school, even though we're only notified about it on Monday. And so we have to go back and do that tracing for those last 3 days that they were in school. By investing in the case identification and making sure that we keep kids out of school, we reduce the number of days that we have to contact trace for, and that's one of the big elements of that first step. But there's also sometimes where, we may be notified on Tuesday, maybe the case onset symptom development was on a Monday, and the kid was out of school. So you're looking at Monday where the kid was out of school, Saturday and Sunday where they were at home, and there's no potential exposure within the school setting that we necessarily have to do contact tracing for. Now, we will talk to the family and make sure that they're not hanging out with anybody outside of school, or that there's nobody else on a sports team that they may have seen over the weekend. And so we do have to do some contact tracing, but it's not to the same element where we're talking about an possible in-school exposure. All right, and I've used that term close contact. So what is it? Primarily, what we're looking for is within 6 feet of one another for a cumulative 15 or more minutes. So not, just cumulative, not just like, I'm here for 5 minutes and then walk away and then come back for another 10. Like, that's cumulative. So throughout the day, doesn't necessarily have to be all at once. And then direct physical contact, sharing, food utensils. Hopefully people are taking a little bit better care to not do some of these things. We saw some elbow bumps here, to kind of prevent that direct physical contact. But those are other things that we're looking for when we're talking about close contacts. And then other factors we look for, one, do we have enough information to make decisions? What classes were they in? What mitigation strategies were in place? Were they symptomatic in school? And did they spend any time with anybody outside? And we do all those things so we can kind of do our risk assessment. I'm going to kind of do a little analogy here, right? So if you think about a shark in the water, that's a hazard, right? But it's really only a hazard to the people who are swimming. You have to be swimming for it to be a hazard to you. And we also know that other things like seals in the water close to you when you're swimming make the sharks more dangerous, right? And so kind of the analogy here is we know that there's a hazard in coronavirus, but we have to define who's in the water, right? And that's what that contact tracing process does. It defines who was within contact where there could potentially be that transmission. And then we also have to look at the other factors, right? Was the case symptomatic? Were they coughing all over the place? Were people wearing masks? Were they congregating in large groups? Were they playing sports, as Patrice mentioned? All these things potentially make the transmission more likely. And so we have to take those into account as well. And so that's where we do our risk assessment process. We put those through with the guidance from the health professionals from the state. They've issued really the key ones for here are Addendum 5 and Addendum 9, which talk about contact tracing in schools, talks about who needs to be isolated and quarantined. And when we do all that information gathering, these are the matrices that we're putting them through and all that information through. So what does it mean to isolate? If you develop positive symptoms, you have to isolate yourself for a 10-day period. That's defined by the CDC. It's because they know that the amount of time that you're shedding the virus is between typically like 5 and 8 days. They tack on a couple extra days on top of it to make sure, and then you isolate yourself at home. To quarantine is when you're a close contact, right? So it's not that you've developed any symptoms. It's not that you have COVID. It's just that you were in close proximity at 6 feet or less for 15 minutes to somebody who has COVID, lab diagnosed COVID. And that's when you quarantine for 14 days. I think one of the things, and the nurses know this because the parents ask it all the time, is why is it 10 days for somebody who is positive and 14 days for somebody who is just a close contact? It's because you know the variable, right? So you know the variable that the person is sick, you know the infectious period, and so you can do that 10 days. The 14-day period is because you can develop COVID symptoms from being in close contact. Typically, it's 5 to 7 days, but it's up to 10 or 12, and so they've conservatively put it at 14 days that you have to stay in quarantine. And so that's why there's that difference there. It's not always fair. We certainly had issues where a sibling tests positive for the case for COVID, and you actually have to do, if you can't isolate that sibling from the rest of the family, you have to run out the 10 days of the sibling's isolation, the case's isolation, and then tack on 14 days on top of it, which is a long time for people to be out of school. But we have had those situations pop up, which is unfortunate for the kids, but in order to protect us, that's the health guidance that we need to follow. So I'm going to talk a little bit about now cases within the district, and we have had a few. We've communicated out on them. We've had really 4 possible cases of school exposure within the schools, 2 staff and 2 students, though the students were actually a linked transmission event. And we've also had some cases outside of school. So we've had 3 cases where there's really been no potential school exposure, and plenty of family members, whether it's a father or a mother or a sibling that returns from college that have tested positive, that have caused our students to have to quarantine. We have seen plenty of those as well. So let's talk about a little bit about how we do it. So as I said, we go through that whole risk assessment, contact tracing process to identify who are the close contacts. And you can see it varies from case to case. In our first case in September, just by the nature of the position of the staff member, we only had to isolate 2 staff and 4 students. But if you look at, the 3rd case on October 8th, you're talking 1 student that was out that impacted 42 others because of all the factors and conditions that are associated with that case. So it's really a case-by-case analysis that we do to track down the close contacts, doing all those things that I talked about earlier, and quarantine people as needed. But overall, numbers to date, we're talking about 100 and I think it was up to 120 today that had to quarantine in total at some point in time throughout the school year here. We've had 7, as I said, cases that have been lab confirmed, and we've had 3,100 other students participating and staff members participating in school as needed. So it's really still been a small sliver of people overall impacted. The other thing is we're continuing to be open and transparent about everything that's going on. We're making changes to that as well, and I'll show you that in a second. I don't see Jen Hill there, but I do see Sue. I know Sue's had to send out communications to classes where a student may just be dismissed for the day, and they may go home through the isolation room that we've set up. Just out as a precautionary basis, we're moving that class, we're cleaning the room, but we do communicate with that class that, hey, just FYI, parents and guardians, a kid was dismissed from that class today. They're sent for a follow-up, and we'll let you know the results. And then, when we get the results in, which have been negative, we send that result back to the class saying, just FYI, the test came back negative, all's good. So we're trying to be open and transparent about what's going on within the schools, even when there's not a defined case, but that something that the kids could go home and say, hey, by the way, Johnny went home sick today and we moved the class. So we've tried to be proactive about the communication there. Certainly, when there's been a close contact within school, it's fallen to the principals and front office staff to communicate with those close contacts. We put in both a phone call and an email to them so that they know what the kind of parameters of the quarantine are. I know John's had to make some of those calls, Mike had maybe too. had to make some of those calls, to let parents know. And then, the emails that come from Scott to the community, every time we've had a potential exposure within school, we're sending out that email so that people know what's going on. We've also posted, and these have been up for a while, some FAQs on the website about all this. Just what is a close contact? How are we treating things? Those have been there. And we just recently put up and kind of rebranded our reopening COVID page to include a dashboard that we're going to update weekly of how many kids are out on isolation or staff are out on isolation, and how many staff or students are quarantined at any given time. And so we'll be fully transparent to the public about what's going on within our schools. And, the numbers do change. Right now we're looking at 45 kids who are currently in, or staff and students who are currently in quarantine. That was 80 as of Monday, because, a couple, in the case of the high school, those kids came back Monday and Tuesday. And so we kind of have those come back into the school and transition back in. So it does change, but we'll update it weekly so that everybody knows. And I think that's does it for me. I think the big things are for us, in terms of lessons learned. We'll continue to monitor state and local health data, monitor those trends within the schools, see if there's any improvements that we can make on mitigation efforts there. Obviously, continue that open and transparent communication, and then the big thing is just community education. So presentations like this, talking with staff, talking with families as they contact and sending out that information is what we need to do to make sure that everybody stays vigilant. We're not yet the cold and flu season. That's going to be a strain on the district, I think. And so we're going to have to make sure that the community knows about it and is prepared for it. And if you saw, as you walked in, you saw a flu shot sign. We've actually had clinics the last 2 weeks, but also next week for our staff to get flu shots. So we can hopefully mitigate, some of that flu season crossing over with COVID. So with that,
If I may, first and foremost, I think that was an outstanding presentation. I think you have a future in public health, Patrice, if there's any openings. That was excellent. Very, very well done, though. And I think what I should have said in the beginning of this presentation, which again was excellent, Brian, why is this on the agenda? And Scott and I had a conversation about this, and we consulted with Patrice. This could be very scary for people who don't understand the public health science behind it, who are not living this every day like we are, like some of us are. And so when you hear there's a positive case, it creates a lot of buzz. And you hear about it in social media, my phone rings, I'm sure board members around the table, I know they have been contacted by various constituencies with justifiable concerns. They want to know what's going to happen and what does this mean? If there's a positive case, should we close down the whole school? And the answer is no. And we wanted to share that information, what happens behind the scenes, the hard work that the administration, the staff, our school nurses who are on the front lines of this pandemic, you're heroes. So thank you for doing what you do. But there's so much that happens, so many moving parts that go into an informed decision-making process. And I'm really proud that in Ellington, we rely on the science, we rely on our experts to make our decisions. And there might be a day when we close the school, but it's not today. And we've looked at every case individually, we've assessed it, we've analyzed it, we've put it against the best public health science available, and so far I think we've been able to have a very measured and strategic approach to dealing with it. And you laid it out. We're 100% transparent, and that's part of why we did this presentation. We'll do it again, Brian. I may ask Scott to do it again. Maybe we'll do it in a different form. But whatever it takes to keep the community educated so that they understand what we're doing, why we're doing it, and how it is in the best interest of staff and students, I think that's critically important. I have a couple other comments, and then I would love to open it up to the board for more questions. Patrice was way too quiet today, so I'm going to give you the accolades you deserve. For those of you who don't know Patrice, I've known her for a while, and I work with her. I have the pleasure of working with her in my day job. She's on 24/7, 365. I will say on the record publicly, you are the best local health director in the state of Connecticut, and we're very fortunate to have you in our school system. So thank you for everything you do. You're very humble. I talked about servant leadership. You're another perfect example of that as well. Very hands-on, always there for us in Ellington when we need you, providing guidance and advice, and we thank you for that very, very much. So with that, if there's questions from board members specific to the presentation, that would be the time to ask them. And then if there's anything that the school nurses would like to add, I'll throw out one question and we'll let the board members ask questions first, but think about this. If there's anything you need from the board, let us know tonight. You know, if there's there's a piece of equipment that you need, if there's more support you need in certain areas, you know, whatever that might be, medically, you know, you're here tonight, you took the time out of your schedule, and when I call you a hero, that I don't say that lightly. So if we can support you in the work that you're doing to keep our district and our children safe, by all means, think about it, and when you come up and speak, if there's something you want to ask of us, by all means, do so. So questions from board members? Comments?
Brian, can I ask you what happens with the buses? I mean, are you tracing on the buses also? Do the kids have assigned seats?
Yes, they do have assigned seats. First student has work to do that. They do have their bus routes there, and they do send them to us when we're doing that contact tracing process. You know, again, you have to have the right information. So I know we were going through one contact tracing process, and the bus driver told the bus yard that they don't really follow the, follow the feed. So we said, well, why not? Now, luckily in that particular case, the student wasn't riding the bus. But, you know, if that wasn't the case, we wouldn't have had the information necessary to limit the number of kids on the bus that we would have to quarantine, and that number would go up even further from where it was. And so we've kind of instituted that with first student, like, make sure that the kids are following that. We do have them for a purpose. And if they're not, you know, like all of our mitigation strategies, if they're not done with fidelity, it's not going to work.
Anything else, Liz?
Yeah, do you, I guess this is for Patricia, do you work with the Hartford Health System and other districts? Because kids are moving around too, as far as when you identify children, do they deal with it, or do you continue to deal with it?
We're in very constant, close contact with all of our colleagues, whether it's a school exposure, a sports exposure. We're talking to each other. We're talking to lots of our colleagues over the line in Massachusetts because there's teams and sporting events that are down here. And so I'm sure we'll all be great friends by the time it's over. But I have the Hartford Health Director on speed dial. So.
And this is where, you know, I mentioned that kind of family and staff connections with the school come and play, and really the nurses doing this. You know, oftentimes Patrice will call me and say, hey, I got a case for you. And I'll be like, yeah, I know, my nurse told me about it 20 minutes ago. And so it's really the work that they're doing to connect with the families and understand what's going on within the families that helps us to kind of get ahead of the curve on some of these things as well, regardless of where a student's coming from.
Thank you. Chris?
I'm curious as to about the asymptomatic cases. I know you said that it's from the day of the test, you're going back 2 days from there, but how confident are you with that they weren't maybe symptomatic, and that should there be like a buffer day in there somewhere, or we're just...
I only play a public health expert on TV. So I listen to like Patrice and the CDC, but I know that's what the CDC guidelines are.
So yes, and that's actually a really good question. And I think at the beginning of the school year, everybody's gotten so used to it, and these nurses are fantastic. But we got used to it from kind of following up on things before school was back in session. So if you start with this template, we're maybe capturing, I'm going to make up a number, 42% of the exposures. It is very far from perfect. And so you're absolutely correct. When you get a test day for an asymptomatic individual, and you're going to say you're going to look 2 days back, because what are you going to do? Look, they could remain testing positive for up to months and not even be infectious anymore. And so you have to make, just like there's a case definition, for any sort of communicable illness, there's like a limitation where we're going to choose this. But you're right, it's certainly not perfect, and nobody should think that it is perfect. And I kind of compare it to Lyme disease and ticks. I tell people all the time, they bring in ticks. I say, it's the tick that you don't know is on you and falls off without you seeing it that's more likely to make you sick. And so sometimes there's so kind of hyper-focused on contacts that aren't close contacts, and parents and other concerned individuals, and we certainly understand why they're concerned. And I say, listen, if you're out and about, are you going to the hairdresser? Are you going out to eat? Are you going shopping? You are getting exposed. Nobody can ensure or assure you that you're not getting exposed. So we have this kind of template of things we can do, but we're knowing that that's maybe this much space, and there's this much space over here that there's things we can't do. But also, we can be fairly confident with the testing data we're getting around us. So, our level of concern, if there's maybe 5 cases in a town, is going to be very different than if there's 500 cases in a town, as far as, our level of concern. We try to be as conservative as we can, and balancing that with the impact on the workplace and students needing to get their education. But you're hitting on a perfect point. They could have been already positive for 10 days or 10 weeks.
Thank you.
Marion?
Well, first of all, I want to thank Scott and Brian for getting the link with the town up so quickly. I'm getting positive results and reports on that.
Good.
So thank you. I brought that up last week and it's working, and I want to publicly thank you for that. But my question is for Patrice. Could you explain why we're using Collin County data to determine our numbers when people are saying to me, I'm concerned that I'm getting little texts that say we had 8 people today, 5 people yesterday, and why are we using Collin County numbers and not Ellington numbers? So could you explain that to me? Because I can't answer that question.
Yes, I can, and that's another good question. So at the beginning, when we were, after the state for months, to develop guidelines to give us context on how we could make certain decisions and advise our schools, at the state level, the state epidemiologist said, you cannot look at really small numbers and draw statistical inferences from those numbers. The numbers are just too small. And Ellington has a very small population. And so the state told us, tell your towns, we're not going to look, they can't just look at the town data. Ellington and other of our towns that are small, you could have a little bit of what looks like, I hate to even use the word spike because it's not really a spike. You could have a blip or an increase of cases, and it could look like a high percentage, but the lower your denominator is, so the lower your population number is, the less meaningful that numerator becomes. And then after the state told us that, 2 days later, they put out town statistics. They didn't tell us they were going to do that. So it's kind of like a fun game of hide and seek in my world. But it continues to happen, and we continue to try to draw people back to the big picture in order to make decisions. And so it's important to keep looking at the numbers, but to be really, really cautious about the conclusions we're going to draw on percentages or rolling averages. And in case people don't realize, I think the state just, maybe it was last week, it's all a blur. They went from a 7-day rolling average to a 14-day rolling average. If you're watching the cases and you're getting case data daily, as I am, you'll see that if there's a situation here, you don't really start to see the results of that for about 2 weeks. And what you should also take into consideration that testing has increased so much across the state, and people are getting tested for so many reasons when you look for more cases, you're going to find asymptomatic cases because you're looking for them. And it doesn't mean that the situation is actually changing. It just means kind of you're discovering a little bit more of the true picture. Does that help at all?
I think so.
Call me tomorrow if you want to talk about it.
Miriam will, Patrice. Other questions, comments from board members, please? Hearing none. Anything that the school nurses would like to add? We'd love to hear from you. Any comments, suggestions, ideas, thoughts for the board? Anything we can do for you?
Another set of arms would be
Supplies. I'm, for mine,
Come on up.
no.
I don't know if the camera goes that far. Well, just speak loud so we can all hear you then.
Gloves.
Gloves, okay.
I've had 3 different orders, completely back ordered. They told me there's 70,000 boxes ahead of me. So that's one thing that we could use. I had a couple, when I started school, but at the end of last year in March, when we went out, they came into our offices and because they needed them in the hospitals and whatnot, they cleaned out all of our supply and I've never been able to get that supply back.
Okay, good. Well, that's
I don't know,
something.
and I've tried, this week I'm actually going to one of the companies that our custodians use because they have the type of gloves. The thing is you can get like gloves that would be, used in a kitchen or whatever, but not medical grade, and they're very hard to come by.
Okay.
Is that
Anyone
true
has
for
it?
all of you? I mean, are you running out of gloves? All of
We're
you?
very low stock. I would say, I know I'm very low.
Because
We're not out, but
for
I'm
that
just
same
saying,
reason,
right, we're
yeah.
just low stock. We don't have as much as we normally do.
The bad one.
Usually we don't find out until the rest of our order has arrived.
Right,
Like, it'll be in stock when you place the order, but then when the rest of your order comes, they'll say, oh, you can take your gloves or your
Now,
Purell or whatever, because it was out of stock, and they don't know if and when it will be back in stock.
70,000.
Yeah.
Good. No, that's good for us to know because I think through Scott, myself, Patrice, that's actually really good for us to know because we could look at other avenues either through state homeland security, public health, and even there, those supplies are low, but you start piecing it together, it could become, viable quantities for you. Better to have, some than none. So anything else that you'd like to share with us? Your experiences so far?
I just think, what Steph also said, extra help, because I know we're short with subs alone, so it's kind of stressful for us, especially, like, I can only speak for myself, I have 2 little kids, so if something happens with them, like, we don't have any subs to, like, if we had to call out, things like that, so that's a little stressful.
It's very,
And then,
it's very stressful.
yeah. And then also, like, just alone, like, the contact tracing is, it's a lot of work. And I could, once again, I'm only speaking for myself, I'm a high school nurse. So one nurse for 800 and something students, plus sports afterwards, it's a lot for, I'll do it, the principals do it, but that's a lot to be doing for just one nurse in a school, I feel like. And I know, like, it's a lot for them too, so, I can only speak for myself on that part.
So do you think you need help with tracing? Would that alleviate some of the stress if you had help with tracing? Because that
Well, I
would take
think
a lot of
that's
time.
hard because it's confidentiality, it's our students, we're calling families that we have, a relationship with, they're gonna tell you things that I don't think they're just gonna, it's not like you can get an office person to really ask them the things that need to be asked for the contact. So I think it would have to be in some way a medical person, or maybe someone to cover her office while she does that contact. Because families, it's a stressful time. If you're talking about it, even telling them they have to get a test sometimes can be overwhelming to them, and they get angry with us. We're doing our job, but it can get stressful at times. And I feel like we have a better rapport with our families. So I think it would have to be maybe something to cover an office for the visits of the people coming in versus, that's my opinion. by families that feel like I know, give me more, the correct information, because sometimes they don't want to share everything that's happening. Some of the cases, the one thing that they were talking about was the cases where you don't know, they're asymptomatic. Some of those, what I'm seeing is that those are being picked up on people who are going in for surgery, and they're required to get a test and then quarantine prior to the surgery, and that's where they're starting to pick up in the ones that I'm seeing, where they're finding that the asymptomatic people are, they're like, oh my gosh, like I had no clue, I was going in this week for surgery, and then you've got to see, okay, if it's a grandparent, maybe they had a family dinner, or whatever, so, we have to trace that as well, so. Just a thought on that.
Just the stress alone of the contact tracing, but, on top of that, like Chrissy had mentioned, I can't see them, but I also have 4 little kids, so, I think the stress of, if they get sick, what are we going to do? Maybe if we did have, another set of hands, with another nurse that could, with a little part-time thing could come in and help, whether they cover the office or they help with the contact tracing, or, God forbid, Danielle said, or Kelly's, anybody sick, we have them on board already at the school and say, okay, I gotta send them home, or they're sick today, you can go cover that school. Luckily not that we're 2 of us, so if somebody needs to leave, I can float to another school, but once it, like Brian said, once cold and flu season comes, it's a little bit more, it's gonna be a little bit more of a stressful time. So, I think
On top of our new computer system.
yeah.
Well, no, I mean, we don't have a staff that knows our new computer
Yeah.
system, so to come in and actually do care, the only way that you could do a medical record is if they need to be, schooled in how to do it. We're still being learning. It's a big change. It started, when we came back to school and COVID and everything all at once, so that's been a challenge.
Now, you start contracting, tracing right away,
Yeah.
and generally, how long will it take you to complete that, to know who's going to be?
Oh, it goes on days. We're getting called on the weekend because that's when the results, like, we're on like 24/7. People are emailing us or texting us all the time because we need to know. We ask them, please, let me know as soon as you know the result, because if it's positive, we've got to call Brian, where, to make sure that anybody that was in contact is going to know. And we're not having people come back into school on a Monday that can't be there. So it's pretty fluid.
Yeah, it's that case identification part that really takes up a lot of those time. And the contact tracing part, the nurses we get a head start on it if we can. If we think it's, we're getting a sense, I think now, of which cases are more likely to be positive and which ones aren't. It's not down to a science, but I think we have some gut feels. So we may start contact tracing process, whether by just grabbing a list of students that they were, in class with, just to kind of get that initial list. And then once that case comes back, whether it's on a Tuesday night or a, Saturday morning, we have that kind of initial work done. Then it really falls to kind of a combination of the nurses, the principals, to some extent, the front office staff as well, to finish that contact tracing process, so that we can identify those people that we need to quarantine.
I just want to make one point. I think we had one situation where the timing was, it's all about the timing with some of these things, right? So we knew we were going to be getting a possible positive case, and we knew the timing wasn't good. And we were sitting here going, well, I don't think we're going to be able to figure out how to do the contact tracing to the level we can do it at the high school in time to kind of like open the school, right? And so we went with a different strategy. Instead of just saying, okay, if that comes back, we're just going to close the school for the day and do distance learning. We basically cast a wide net, a very wide net. We said, let's just assume we can't do the contact tracing. What is the maximum exposure of this particular situation? And it ended up being, the number was like 165. And we're like, okay, so if it comes back positive, we have no time to contact trace, we're gonna contact all 165 of those individuals, and we're gonna tell them, you are silver group for this day. For one day, don't come in. We're still opening Ellington High School, which means you're still gonna get, good 650 kids still coming to school, right? And then that day, we do the contact tracing, and that 165 number could go down to like 42 or 35 or something like that. And then we say to those kids, you're quarantined, the other 130 of you, you can come back, right? So that was one strategy where we know there's a significant benefit to the community that we serve to keep the schools open, if we can do that in a safe and measured way. And so that was one strategy we had, but we didn't have to use it, fortunately.
And if I could just acknowledge, thank you for being transparent, candor with your concerns. We heard you, and we will work with the administration to address them promptly. And thank you for the work that you do very, very much. We appreciate it. If I may, I know we have to move on to the agenda. You mentioned flu shots.
Yes.
Are we doing a clinic for staff? Do we normally do that in-house?
So we normally do it every year, and participation, I think, is between, 70 and 80 or so in a given year. We expanded that this year, and I believe we're probably approaching 150 to 160 staff members that are going to end up getting a flu shot.
Who administers the vaccines?
This year we went with, I think it was affiliated physicians or affiliated nurses. If you're looking at the burn-in nurses, we've used them in the past, but for some reason it didn't work time-wise for us.
Okay, that's good. Well, Patrice has a program as well. I don't know how stretched out her program is, but that's always an option as well. We can certainly take a look at that if that's something you want us to look at as well, Patrice. But again, thank you, Patrice. Is there anything else you want to add before we move on?
No, I just want to say that it's been just a pleasure. We're getting people are hitting the wall in local public health departments, like a lot of people, and working with all of our school partners across our district has been just so encouraging. We're really getting to know each other well. But, when you can have a laugh about it or say, you're talking on Saturday morning, on Saturday night, on Sunday afternoon, you do get this sense that you're all in it together. And I think, to me, it's very satisfying. And I know a lot of times the end user of the kind of services we're providing now isn't fully aware of all that's done 24/7 behind the scenes to kind of keep them as safe as they can. For me, that's not so critical. Like I know we're doing it, and I just really value the partnerships very much.
Two-way street. Thank you. Thanks very much.
Thank you.
All right, presentation and continued discussion of district improvement plans 2021.
All right, good evening, everyone. Good to see you all. In your packets tonight is a memo from me that gives a recap of feedback that we received from all Ellington Public Schools staff on priorities to be considered to be included in the 2021 District Improvement Plan. The staff feedback form that was sent out was developed in conjunction and as a result of the October 7th Board of Education Reopening Committee Workshop. So we had 159 staff, all different categories of staff, completed the survey, and then in the memo lays out the top, basically, priorities that staff gave us feedback on. There was also an open-ended response, and the clear theme in the open-ended response was to continue the early release Wednesday for a variety of reasons that I'll be happy to speak with you about. So at this point, I'll turn it over and happy to answer any questions from the board.
Questions, comments from the board? Chris?
I'll comment, and I made it last Wednesday at our workshop meeting, and I've talked to you about it before, so I'd like to say it in open form at this point. That, I've heard so much feedback from the teachers that these Wednesdays, the early release Wednesdays, are so important, and I personally feel that as long as we are required to offer full-time distance learning as an option, and we're requiring our teachers, especially the high school teachers and most of the middle school teachers, to do full in person and full distance simultaneously. I think the very least we can do for the teachers is give them is allow them to have that, the early release Wednesday through as long as we need to offer the distance learning, because that gives them a little bit of time to not have both at the same time, to check in with the distance learning kids, to collaborate, and just, I think it's so important. It's 3 hours, and I just think it's so important for the teachers. What they gain is actually a gain for the students as well, because of, giving them a moment to breathe, as well as time to get everything else done that they need to get done.
Thank you, Chris. Liz?
And I have to agree with Chris. I think it's really important for the teachers to realize they'll be able to collaborate with the distance learning teachers, and also give the kids a break. They've been wearing masks all day. It's 3 hours, but it makes their afternoon maybe a little more fun on a Wednesday. But the teachers, if the teachers are working together and collaborating and getting the materials they need for the kids and the ideas they need, I just think it's such a benefit to the entire district, to the kids and the parents and the students. The students and the teachers and the administrators too, for that matter. So I'd like to see it continued for as long as we're involved in this situation.
Thank you. Karen?
I'm not sure if this is an appropriate time or not, so if it's not, that's fine, I can wait till later in the meeting, but I did get an opportunity to listen to and I think it ties in with the Wednesday thing, because we're doing some extra things, the teachers are doing extra things. That's why made me think of it, but I did have an opportunity to listen to the meeting where they did the focus group with the Silver students. It was on the Chromebook or whatever, so I did listen, and I think that having the Wednesdays and doing the teachers to be able to have extra time to do things like continuing to work in different areas, whether it's the distance learning piece that we're still working on. And I don't think it's just for the Silver students, I think it's for all students, because the better we can perfect that, even on snow days, or if we have to use that model. I will say that the students themselves on the meeting seem to have some additional ideas that really weren't presented in our workshop. So I think the teachers need time to develop to work on those things, and having those Wednesdays is critical. And I hope the school district is still going to continue with that work, because I don't think that it's all smooth and we have figured it all out at this point. And that's why the teachers I don't want the public to go, oh, they get a half a day. They're really not, because they're doing all these extra things. And we're still working through what things are going to look like and how to make it better, right? So I don't know if it's appropriate at this time, because it dealt with the Wednesday thing.
Very much so. Thank you, Karen. Other comments or questions? Yes, ma'am.
Well, I asked Brian, if this was something that we should make a motion on. And we talked about, whether it was a calendar issue. And I guess I'd like to propose the idea that we assess this like monthly as we go along to continue it with enough time so that parents can plan ahead for the next month. But I think it's critically important for our teachers and for the kids. What we're doing is improving their education.
I think that's well said, Mary. I know Scott's looking at this more than monthly, daily, and working with the staff and his team to come up with recommendations. But that's something we talk about at every Wednesday workshop meeting, and we'll continue to do so, Mary. I think you're right. We've got to get the word out as early as possible if we're going to continue or to make any changes to it. Carrie?
One more thing about I know you're saying monthly, to assess it monthly. I don't necessarily think it's a bad idea, but I almost feel like it would be better to be able to just commit to it for the entire school year. And I'll tell you, with parents that I am in communication with, they're like, well, I thought this was for the whole year, like when it first started. I'm like, no, it's just for October. But I think it will get, I was feeling like it could still get extended. I said, I think it may get extended, but I feel like it would just be easier for everybody all the way around, the teachers and parents. And if we haven't gotten a lot of negative feedback from the parents, I'm not fielding the calls, but that we just say it's for the school year, and this gives the teachers like, okay, planning, okay, we can work on these different projects that we're working on, and parents know the expectation for the school year. What would be the downside, I guess, if any, to doing that? Because I feel like the month-to-month thing leaves people hanging. They're waiting every month to find out.
Yeah, I would suggest, obviously this is a concern. Brian raised it. The board's, is very passionate about this one particular thing. We're getting calls from constituents, and you have some ideas from what we're saying and what we're looking for. I would just say, Scott, I think this should be the focus of our next work group meeting. We can talk about it in more detail. I don't think now is the time to make a decision on it. I'd like to get more data from you. Let's see what the trends are. And then if we can make a decision that can go out a month or two, that could be a communication that comes out of your office on behalf of the board. But I'd like to spend more time on this issue and examine it some more before we make a decision or a motion tonight from the board's perspective. That's my opinion. If other board members have other things to share, by all means.
Just that it is almost the end of October,
Right.
so they will need to know soon.
Agreed.
They've already been communicated about November, right? And we discussed for about 25 minutes at the last workshop this topic. It's a good topic. I think the general premise of if you're in distance learning, and you offer that option, we're required to. I see the logic behind continuing with the Wednesdays being half days. I think I'm in support of that. I think what we have to be mindful of is we've been very, and I'm not saying when I brought up a couple month-to-month situations, that doesn't mean month-to-month all the way through June, right? And what we've been very good at as a board and as administration is we've been thoughtful and methodical, and we have discussed and allowed a lot of maximum feedback from a wide variety of groups, and we've been able to communicate that and slowly have our community understand and be educated and feel that we're being transparent with our communications and that there's no surprises. And so part of what I committed to the board at the last workshop, if you remember, was I said that in my communication last Friday, I was going to make a point to state to the parents of how important the Wednesday half days were to the teachers for the benefit of not only them, putting them in a good position, but for the children, right? So I feel very strongly about that, as all my team does, that is very important time for the teachers to have. Now that has gone out, right? Now you allow the community to digest the information. We're talking about it here at the board meeting, which is being live streamed, which we hope that, I don't know how many people are watching, but we hope the community's watching. And then, so let's continue to have the conversations. Let's talk about it next week, and let's kind of see how we progress with this. Maybe we can make a decision. Maybe we have to hold a little bit. What we want to try to avoid in any of this, whether it's this situation or another situation, is because things change so herky-jerky in different ways, that's very hard to predict, is we want to make sure we don't make decisions and then go back on them, if we can avoid that, right? And so I'm not saying that necessarily applies exactly to this particular situation, but I've just been very, I've been very cautious and methodical with trying to kind of keep the public lock in step so they're not surprised. That's key for us in our credibility and trust with the wide variety, thousands of people that are wondering what the school district is doing. And if we can keep that like steady Eddie approach, that's one of my strong recommendations. So I like the comments that I'm hearing from the board. I think they're great. And I think discussing it next week again, in detail is really important.
Just one last thing
Very good.
to respond to that, Scott. Scott, even if, let's say next week, we get a call that school is full back, there's no mask, everything returns to normal. What is the harm in, just thinking my head, what is the harm of committing the year to the half days? Because there's still work we have to do I don't think we should let the distance thing go because that's gonna be such a valuable thing for the future and allowing this flexibility for kids to learn. So I hear what you're saying, Scott. I'm just trying to think like it gives some sort of consistency and stability to parents out there if we are able to commit to something for the year, regardless of what the circumstances brings us. Because the best case scenario that would cut against doing the half days would be if we were completely back to normal, there'd be no reason presumably to have the half days, right? Is that what your thought process is? I don't know, is that what
You
you're?
know, my only thought process is, we want to time it properly. We want to make sure, when you think about thousands of people and trying to ensure that they are in a good position to feel like they trust the school district and know what's happening, which we've been doing a great job on. My only point is, it's the timing and the process and trying to really check all the boxes as best as we can for as many of our different constituents as we possibly can. That's all my point is. And we're doing that very well on this front and a lot of other fronts right now. And if we keep that rolling, and the timing may be perfect, Karen, next week. You know, and having the discussion right now moves that conversation, because it'll be like a 2 to 3 week timeframe where the community will be processing that Wednesdays, early release days, the why and how long they'll start to kind of get themselves in that position to be ready to hear that information, if that's exactly where we went.
Good. Thank you, Karen. I'm glad you keep moving. Any other comments or questions? All right, anything else?
Yeah, I just wanted to mention, Dr. Young and I had a conversation earlier today, and the upcoming curriculum committee meeting is going to have a theme on why Wednesdays, what's the importance of Wednesday, and process our various initiatives and how Wednesdays support that. So I just wanted to bring that to the attention of the board based on the comments, to let you know that we're looking at doing additional due diligence, to your point, Mr. Picaro, to make sure that we are clearly communicating the value to the community that we serve. That those Wednesdays are important, the time is being used wisely, and it has a positive impact on instruction of students, both in person and, to Carrie's point, the distance learning students. It's a win-win-win for everyone, and we need to continue to communicate that. Also listen to opposing viewpoints on that, because I just have to tell the board that as much positive feedback that we do hear from that, it still is a burden to some of our families that we serve to have, to arrange childcare, to arrange other ways to make sure their children are safe on Wednesday. And that's something we also have to take into consideration and make sure we do everything we can to meet the needs of all of the students and families that we serve.
That's good. Good point. That's right.
I would just like to invite everyone to next Tuesday, 5 o'clock here, for that. If they have input, we can consider that like a fact finding as well as an informational chance for the curriculum subcommittee to kind of look at several issues, including the math curriculum in the middle school and some of the concerns with class sizes and things related to the Wednesday. We've actually talked about kind of making that the theme of all of the content in our agenda.
Good. So between the curriculum committee, our Wednesday meetings, we have lots of opportunities to further discuss it. And Mark Mahler, Mr. Mahler, I did see out of the corner of my eye doing a strong north-south with your head there in support. So really noted for the record. All right. Thank you, Brian, for your update. Thank you, board members, for your input. Next item on the agenda is the regular board committee reports. Curriculum, there was no curriculum meeting held, but Dr. Young, respectfully, is there anything you'd like to add?
No, that was my report.
Okay.
Next Tuesday at 5. Thank you.
Okay, finance, Chair Dory.
Yes, I'm going to, I have two things on the agenda to talk about. One was what happened at the meeting, and the other is the medical account that we're looking into, reserve account rather. The first thing we discussed was the object summary, and we were looking at the new accounting system. And of course, there's gonna be things that we have to get used to with that too, and there's some.
Just a procedural question, but you're doing just fine. Keep going.
I'm listening to you.
All right. You sure? I think keep
Yeah,
going.
Please do.
For instance, some of the object numbers are different, and, for instance, I was looking for what we have budgeted for substitute teachers, and that was really under uncertified, but we can bring that all out when you click on it, hopefully, Brian, right?
I found this.
You know, that's okay.
What was the question?
That we will we have access to, look at the accounting system and bring up information on our own? I mean, we wouldn't change anything, but will we be able to access that?
Oh, yeah, when you say as board members?
Brian,
board
Brian,
members,
Liz is talking about what we discussed at the last meeting, which is with the new accounting system.
Yeah.
We'll have a greater level of detail to do more analysis on our end. So if we want to
Yes.
bring up, subcategories within line items in the budget, and so right now it's like personnel, right?
Yes,
Yeah.
correct.
And then-
Right now, you get the object summary, which is kind of what was done
Yeah.
in the past. If you wanted to dive into all the sub-accounts within an object, yes, we can absolutely do that. And in the budget, if you recall last year, we gave you a line item detail of all the different accounts, all 500 plus accounts within the budget, and we will do the same. It'll be formatted a little bit differently because we were transitioning between the two systems last year. But it will be that kind of level of detail within the budget process.
And I asked Brian to give me, the details of the choice account, and it was like 15 pages. So,
Yeah, there's a lot of detail that goes into all those sub-accounts, and probably some of it is not necessarily worth the board's time, quite frankly, to kind of go and look at each individual transaction. Obviously, that's what you pay me and my team to do. Make sure that those are run with controls in place and everything like that. But certainly anytime you ever wanted the data, it's there.
Could I follow up before you go? Does Infinite Campus and its data visualizations have the possibility of giving us kind of control to pull that up remotely?
Yeah, just to clarify, it's Infinite Visions, not Infinite
I'm
Campus.
sorry, Infinite
Yeah,
Visions.
it's, so I think they're working on building out their HTML5 platform, and there certainly are user-based visualizations that,
Right.
certainly I can see and the admin assistants and principals can see. I'm not sure there's yet a public interface to that.
So, I'm just thinking that would be really helpful on nights that we're up till 2 in the morning doing contract negotiations and things, to just be able to.
You want to compound the pain, is that what you're saying?
Point taken, I'm gonna be quiet now.
Okay, because I'd like to see that too.
Yeah.
Okay. Then we talked about the choice program. We do have a balance to carry over to this year of $286,554 for a total of $862,214. With the CARES Act, we received about $151,000 and possibly $40,000 for transportation.
So it was 51,000 for the CARES Act, ESSER. We received another 140,000 for the coronavirus relief funds, which is a state grant as opposed to the federal grant. You're right, there was initially a provision where it was $40,000 for transportation, but we were actually able to reallocate that this week into non-personnel COVID cleaning supplies and PPE. And we did take that opportunity because we know that we've already spent basically that $40,000 and can transfer monies into that. Whereas the transportation, there are going to be some smaller costs, but possibly not all 40,000. So we just said we're not going to deal with it all. We'll take care of the transportation as it comes along, and we'll utilize the full grant to the extent we can.
We also talked about the HVAC system and whether or not it would be the cost of maintaining it at the way we're full capacity. And also whether or not some of the systems may break down from overuse. We don't know what will happen.
Yeah, certainly it's a greater probability as we're running them more often, that certainly we're gonna have to do more filter changes, and pay people to do that. Certainly there's going to just be more exhaust fans that, have to be replaced in normal wear and tear, as those usage times are increased, but, we'll manage that, and hopefully it won't be a budget buster, but we'll track it as it goes through the year. It's too early to tell, quite honest.
And we also mentioned having air quality testing when the kids are in school, get an understanding of what might be, they might be breathing too much CO2 or whatever the levels are that will be tested. Also, we talked about the calendar, and this year is a little bit different than before because there will be more faculty involvement in the planning of the budget, and I'm trying to find that.
Yeah, we added a workshop in December, as kind of a part of the workshop series that we've been doing here, that will include faculty as well, kind of as an initial point before we get to the superintendent's presentation of the budget in January. So that's really the one big extra layer. Obviously, I actually sent my budget notice out to principals today, made sure that they have formal, every school's a little bit different in how they run it, but I did include in there that they have to have formal ways for staff to participate within the budget development process as they do that kind of over the next month or so as well. And certainly we can report out on that as we get to December and January as to kind of how that process went.
I think that's a great idea, and we will probably reach out to the executive committee of the union and get some input from them too. So that was pretty much the meeting that we had.
Good, thank you, Liz. And Brian, Jen, Liz and I were batting around a few ideas in regards to your draft timeline as well. And respectfully, Scott, I'll follow up with you before the next step. We'll make sure that any further publicly or board meeting. But we just have a few ideas that enhance the process.
Yeah, and we still have to do actually a follow-up finance committee so that we can kind of go through those things that you were talking about and formalize it to come to the board for a full vote now in November.
Questions for Liz? That was a great report, Liz. Thank you. Any questions for Liz?
Should I go on to the medical leave?
Please keep going.
Okay, so Ryan drafted an ordinance because we need an ordinance to start this. And he went to the Board of Selectmen, and they also had some financial people from the finance board there. And we were able to give back the town the $909,000, and we would be putting $233,000 into special account while we research being self-insured. And it would be seed money. It really belongs to the town, but the town would hold it for us in a special account. But in order to do that special account, it has to go to the ordinance committee, and they have to approve the ordinance. And after that point, it's like a building comes up. And after that point, if they approve it, then it goes to the Board of Selectmen for their approval. And then finally to the finance, the town finance committee. And if that's the case, they will hold that. We will decide what we're going to do with it specifically. And we will have to add more money to it because in order for us to go ahead with this, we have to have at least $500,000 in that account. Unless that changes. We have an opportunity to look at different things. And if for some reason we choose not to do it, the money would automatically go back to the town.
That was
Did I
great.
miss anything?
No, very good summary, and I will say I presented, so it did actually already pass through the ordinance
Oh,
committee,
good.
and to the town. They've, referred it has to go actually through a town meeting, so a public hearing and town meeting, so those dates are, currently being set. I also did present, the following day to the Board of Finance, just to give them kind of a heads up as to what, the board voted on. I think we voted on this in August, it could have been July. So I gave them a heads up as to what the ask will be, to move that $223,000 into the medical reserve account. And they were all on board, with the concept, and were enthusiastic that we were kind of, pursuing this and thinking long term, with the extra money that we did have.
Good. Nice work. Thank you. Questions for Liz on that topic?
And there's that town meeting.
I'll look for it tomorrow. I think typically they try and do them the same day as the regular Board of Selectmen meeting. So I would expect it on the same day, but I will follow up and get that detail confirmed.
I'm just asking if you need people to be there.
Yes, once we get that, we will let you know. Quite frankly, I don't know off the top of my head how they're managing town meeting protocols in the time of COVID. I know they're trying to limit the number of people in the room, but I don't know how a town meeting is potentially impacts that. So I will get all that information to the board so that you can certainly come and support as a member of the town, a resident of the town.
Thank you. Anything else, Liz, that you'd like to share?
No, I was just wondering the timeline, you think if we would know about this in a couple of months or?
What in particular?
That it's, Isabel, that.
Yeah, well, so the town meeting, as I said, should probably be the same day as the November Board of Selectmen meeting. And so that will establish the count. Don't believe there's any runoff period, but I can double check that. And then in terms of the Board of Finance meeting, our earliest opportunity to move the money would be in December. One of the things I did tell them was, certainly if they wanted to, we can give them a more full accounting of what we expect our budget to be this year if they were uncomfortable moving the money, so that, basically that we didn't need any additional monies this year to cover COVID, additional appropriations. And so, that might be January timeframe that we could, give them a really good update on that once we've been in for 4 months. And so, it'll kind of depend on how they feel, how comfortable they feel with their reserves before they make that decision.
Thank you, Liz. Policy Committee.
Policy did not meet, but our next meeting is November 10th at 5:15.
Good, thank you, Chris. Operations,
No, there was no meeting.
Communications, Jen?
We did not meet. Our next meeting is November 10th at 6:30, following policy. I will be working with Brian, and we are going to do another episode of Behind the Scenes with the BOE. As mentioned earlier, as far as getting different forms of communications out, we will be doing it with the school nurses.
Okay.
So that we can go through some of the contact tracing that way. And I did, kind of write a note to Scott as we were in here. As part of that, I'd like to, whether it's breakfast or lunch, I like tacos. Maybe we can bring tacos to them. I kind of think that we need to show our appreciation to them somehow. So when we go to meet with them or whatever, I think that that's something we should make sure that we get done.
Okay. Good, any questions from Jen? Dr. Nichols, Superintendent's report.
Okay, I have several items that I believe will be of the board's interest. One, an announcement here publicly, and then out to the staff Thursday or Friday. Marsha Cooper-Schmidt, Dr. Young, and myself had the good fortune to attend the EDU Innovate annual meeting over at John Mosier's place. It was there that he announced that EDU Innovate has decided to and wants to thank all of the staff. So not just the teachers, but paraprofessionals, custodians, administrators, part-time, full-time, every single employee of the Ellington Public Schools. And we'll be providing them next week sometime a $25 gift card to Luann's, which will in tune from EDU Innovate well over $10,000. And to thank them for their support. So there'll be I'll be sending out a correspondence on behalf of EDU Innovate, and I just want to publicly thank them. They are great partners and supporters of the school district and their work. And certainly all of our staff members, soup to nuts, deserve a nice lunch at Luann's. And so it's just a really nice moment for the Ellington family, right? That's what family members do for one another.
Very generous.
Extremely generous.
Yes. Secondly, I had the good fortune to attend, and I won't steal any of Ayushman's thunder, but Ellington Equity had their third event. I was able to attend it, and the reason I went was to support Angelina Miller and Ayushman. Were on a panel, and they had a guest speaker from Central Connecticut State University, a professor, Gerald Duquette, and the topic was bipartisan discussion of voter education. So a nice event, and Ayushman is certainly making the rounds in Ellington. He's everywhere, and that's what we expect our Student Board of Education rep to do, and he does a nice job repping that. Also, I wanted to mention, as you well know, the town has an ad hoc diversity committee. They're meeting the first Wednesday of the month, and they had their first meeting. Melissa Haberin, who is an administrator in the Ellington Public Schools, also a resident and also a parent of a beautiful little daughter who goes to Center School. She's the appointed school liaison to that committee. And her role is to ensure that the school district is supporting the town's work in this area. And because we have been working on this work for quite some time, we certainly have a long way to go, of course, for her to be able to be the liaison and share our experiences and our best practices and different sort of expertise to help the town in their diversity work. So we thank Melissa for taking on that extra responsibility, and I know she'll do a great job. Moving along, just because we're in COVID and things are just a bit different, right? So just some things that normally occur that have a little bit of a change. So, and this is something you will get an invite for. So Veterans Day, we know Veterans Day, Ellington does an outstanding job with it. It's an amazing commitment by our students, in particular honoring our veterans. So for K through 8 this year, we're going to be working up a video for that, as opposed to an in-person sort of situation, where we hope to get the video honoring the veterans done prior to Veterans Day, and then be able to show it also in the schools, and teachers may be able to do activities and different things that they want to do with that, and then really push it out to the veterans and have it be a nice thing K-8. Now, the interesting part about it for the high school is, and we know that the high school event's awesome, right? Like great event. The thought was to do a video with that too, but the students really, really want to do something for the veterans. And so Mr. Gidry is working with them right now, and we are going to do an in-person event. Now, it's not going to be to the scale of the drive-in movie theater in Mansfield. That was something really special. But we're looking on Veterans Day at a rain date of the 13th, out in the front parking lot, a much scaled down. So like a 30 to 40-minute event. We're working out the details, but just imagine veterans will be able to sit 6 feet apart with one another, or if they want to sit in their cars, they feel more safe doing that, they can do that. It's basically going to be some student speeches thanking them. They have gotten one. The students really wanted. I'm just looking at my text here from Mr. Gidry. Greg Karen is an alum and also a veteran, a local businessman. He's going to be the one adult speaker, so it's much more scaled down. We are going to invite certainly board members to come to the event and stand outside and honor our veterans. And also we'll be inviting some of our legislators and those sorts of people. And we're keeping it under a certain amount of number within the executive order and the guidelines. But the kids pushed for it, and Mr. Gidry, who's a great principal, listened to him, and they're gonna have an event outside, so that's a great thing, right?
It is a great thing, Scott. It's important for so many reasons. What was the date? Did you pick
So,
it?
Wednesday, November 11th is Veterans Day.
Yep.
If it rains, we're gonna have it on Friday the 13th.
Okay, so on Veterans Day, rain date 13th.
Yep, and we'll get you out the invite and everything. And it's in the morning, so it's probably, I believe, it's more around probably a 9 o'clock-ish type of thing I'd have to see, but we have to go by some of the kids' schedules and stuff with how we're figuring it out. So that should be good. So moving along, some differences in traditions that we have, Halloween, right? For the middle school, the high school, similar, right? Halloween has always been, they've always had Spirit Week on when Halloween falls. And so that's going to be the case here. So nothing new, nothing different. The kids work on Spirit Week at the high school and middle school however they want. There's a lot of ownership to it. Of course, any sort of spirit activities, whatever goes, we'll have the proper social mitigation, social distancing, all those different things that have to be part of it. So that's pretty standard. Some changes here for the elementary schools. Very minor, different changes. And remember, like these are all traditions. The elementary schools do different things and have different involvement from the PTO in different ways for different events. So we allow them to kind of do their thing and how they want to do it, right? So at Windermere, typically there's like almost like a K2, K1 indoor parade, costume parade. They're not doing the indoor parade. That's just not going to be appropriate with what we need to do. But K1, if it's nice out, they're going to do a modified parade for the kids outside for the little kids. K2, they typically have done some like parties, right? Like, they do the parties and they eat within classroom. It's a really fun thing. And they're in the costumes. It's like really amazing. They're not going to have, they may have a party, but there's not going to be food eaten within the classroom. That's just not going to work right now. We're not going to extend having the masks off and eating. So instead, they're going to be food that's going to be donated to that is going to be picked up and they're going to be able to bring it home appropriately so. So they'll get something to eat when they go home, which if you're a kindergartner, first grade, or second grade, that's fine, right? Like you get a treat to go home with. You still got to wear your costume, kind of cool. Crystal Lake, they typically have done like an indoor trick or treat situation with the PTO. That's just not going to be possible for now. So with the PTO and they're usually involved in this particular one with Dr. Nash Stitzel. They're doing they're going to be wearing fall colors, but they're also doing crazy hair. Don't ask me how fall colors and crazy hair is a thing, but clearly on Halloween on a Friday they will wear fall colors and have crazy hair, and that's going to be fun for those kids. So really cute. We'll get some good pictures on that. Now, center school, always the biggie, right? The center school, walk around Arbor Park with all the costumes, like super awesome event. Everyone gets excited for it. So everyone loves it. The teachers love it. The kids love it. The parents love it. It's not appropriate to do it. It actually would violate the executive order if we did it how we normally do it. It's not appropriate. So what we're doing is we're doing a modified Arbor Park events, okay? So in the past, it's usually like, and I'm sure some of you have gone, it's like the entire school lines up in their costumes with their teachers and they snake through the building and they walk through Arbor Park and the parents are all there and they do video. We've done like cool videos with Alan and everyone cheers and they walk around like 4 or 5 times and it's a fun thing. It's really nice and the kids and the parents love it. So instead, we're stretching it out over the whole day, okay? And we're gonna have like, just like kindergarten will be between like 9 and 9:15. And he has, Mr. Verderam sent something out, he has a schedule, but they'll get together and it will be like 3 sections of kindergarten. They'll distance appropriately, they'll wear their costume with their mask, so they have to think about that, whatever they wanna be. And they'll walk through Arbor Park. Only one relative, parent, guardian is able to go and watch because we're trying to stay under certain numbers of events. We can't have 200 people together. Keeping it under the 150. So it's okay. So you'll see, so basically you're gonna have kindergarten through 6th grade spread out over the day and like 6 different mini events with the parents able to go. So the kids still get to do the costumes, still get to walk in Arbor Park, still get to have a family member there. And Marcia Cooper Smith's gonna have to, kick her daughter out, and be the one relative for her granddaughter. So that's what they're gonna do for Halloween, and I think it's good, like, what's here's the easy thing to do. The easy thing is, in these times, is to cancel this stuff, and just do like the minimum. That's not what our folks are doing here. They're being creative, and they're trying to do as much as they can, because it's good for the kids and it's good for the community. And I applaud our principals' efforts and our PTO's efforts that are contributing. So, last thing, and this is just the book fairs. The book fairs are essentially they're the virtual book fairs right now. So it just doesn't really work out right now for the PTOs in the middle school and the elementary schools with the book fairs to have in-person book fairs. And so those are virtual. And I think that was a good decision, and they did them last year. It does cut down on some of the revenue that they bring in. And typically there's 2 book fairs, usually one's driven by the PTO, one's driven by the school. And so we're just gonna have to, when we go through the budget process, and there are certain things that constantly get funded through these book fair monies from the school and or the PTO, the revenue will be down. And we're gonna have to just monitor that to make sure that there aren't certain things that we wanna make sure the kids have. And that could drive a little bit difference of our budget process, but we're not talking tens of thousands of dollars. We're talking, in total, a little bit lesser of money. So we'll cross that bridge when we get to it. So that's the superintendent report.
Thank you. Questions for Dr. Nickel?
I just had a
Sure.
question on the, it came up today actually, so I'm glad you brought it up. On the center school parade, the silver parents got apparently invitations to it, but I think there was a little confusion, like, are they gonna be, is the silver kids gonna cohort separate in the parade? When are they supposed to show up? Because it doesn't really lay out so one of the parents is like, yeah, we're invited because we got the invitation, but then the other parent was like, no, I don't think so, because there's no, when do they show up to go? Because they're not obviously cohorting with their regular grade, so
It's,
the communication, I didn't see it personally, I'm just telling you there was some confusion there.
right, so working out the details on that. But this is a unique circumstance, so it's not like the kid, it's a fun thing. And so we're going to allow, like, if the kindergartner wants to come and join the group and sit in go in the back and walk through and then leave for the day, we're gonna allow that to occur. We don't want the center school kids to miss out on that. So we're working out the logistics for the silver group parents for that particular event for them to come. Especially because it's basically, for the most part, outside, and it's only like 15 minutes to 20 minutes, and it's a quick in and done type of thing. Can't say no to a kid in a costume. You kidding me?
No, but I also think there was some confusion at the middle school as well with some of the sports things. A lot of the students that are silver don't get the morning announcements. They're not part of the pledge. They're not part of the morning announcements because the teachers don't turn the meat on until they're ready to teach. So a lot of times we end up getting information from another student that was in class that says, oh, you're gonna miss this meeting if you wanna sign up. For example, the drama club is all virtual, but we didn't know about it. We only got the meet because another kid sent us the meet, because they have friends, right? So there's a lot of miscommunication in that regard to, I know that's not on your agenda report, but just in terms of, I guess it has to be clear, like, what are they invited to and what are they not invited to? And that if they're doing these intramural sports at the middle school, I've been told that they're supposed to get invited to that if they want to do cross country or whatever, but they haven't received the information, I don't think, in order to do it.
Okay.
I've never received an email regarding any of that stuff, and the kids don't get the morning announcements for some reason. So I think that, just as a suggestion, it's fine that the kids aren't part of the morning announcements, but then it should be sent over in an email. Here's what was announced today at the school.
Okay, I can look at that. Thanks for bringing it up, Karen.
I can speak for the high school. Each morning we get a daily bulletin, which is basically a written copy of the script that's spoken over announcements. So maybe that's something to consider for the middle school as well.
Thank you. Other comments, questions from the superintendent? Thank you, Dr. Nichol. Director's reports, monthly financial report. Mr. Greenleaf, you're back on. Brian, I will say as you're preparing for your presentation that this memo that we've asked you to do is very helpful.
Maybe that's what it's like.
I think I'm gonna wait. I'm gonna wait.
When the ignored was paid.
Sorry, I am listening. I always, just, when it looks like I'm not. Multitasking.
Keep
Brian,
going.
I just want to say thank you for this memo that we've asked you to put together. It certainly saved me from asking 4 or 5 questions by you providing the explanation. So I don't have any questions about at least the financial report, but by all means, go ahead.
Yep, so I know we talked a little bit about this last month, in Object 210, it looks like there's a big negative balance there. We did figure out what that issue was, and it is just kind of a new learning for us as we implement a new accounting system. And so basically, you know, for the first time ever, we have the ability to do encumbrances on group insurance, which is really great, and the system tracks that. But we kind of continued with our old way that we pay for bills out of the expenditure account instead of out of the liability account, that then the software works through. So it's a little bit more technical, a little bit more work for us to kind of make sure that it tracks all the way through the year. But we get that benefit of the encumbrances. And so we just have to do a journal entry out of the expenditure account into that liability account in order to properly account for these things throughout the year. And so once we do that, prepare that, it'll show as probably a small positive balance.
Questions from Mr. Green from the report? Okay, seeing none, thank you, Brian. Board liaison report. Gonna go right around the room. Jen, you have anything?
No.
Chris? Mary? Dr. Young? Nope. Liz?
The finance, basically, it's given what I told you last week.
Okay, thank you, Liz. In the interest of time, check your emails. There's some cave events coming up. Save the dates and so forth, and check your emails. We'll have more information coming out through there. Jen? Gary? Marcia?
What was your question?
Liaison, school or any committees that you're on, we're doing it all in one
And
shot.
I did speak to Mr. Reed at Center School, you know, and they're just doing great over there, and staff and students doing a great job with mitigated strategies. Coverage for lunch and recess is still a challenge, but they continue to work at it, and they're very happy with the high quality instruction that's still taking place. So we had all good things to say.
Thank you, Marcia. Any questions for Marcia on that? Okay, Gary?
Correct meeting today was, I don't know, canceled for some reason. I probably had to do with using Zoom because, I guess I'm not the only one not being able to be able to use it. I'm so frustrated with Zoom stuff. You know, Zoom is the only one that doesn't work with me. The other, what do you call them?
Google Meets.
Yeah, and all the other ones work except for Zoom. And so I'm having a big battle with Frontier, and I'm switching everything over to Comcast so I can get cable, which is more, I guess, more data and faster. It doesn't matter. I just got a phone call now that my buddy who's gonna do it for me couldn't come tonight. Now I'm done with it more days. And we're in frustration for 4 or 5 days.
Well, thank you anyways. We'll refer to your report when the meeting occurs. Thank you, Gary. Irishman?
Yes, actually. I'm going to go back to some things Dr. Nichol was talking about. The Ellington Quality event. I'd just like to personally share that it was a really good time being there. Got to hear from some local candidates, and the keynote speaker was amazing, political science professor. he also mentioned the new ad hoc committee on diversity and inclusion. I'm a member of that committee as well as the student representative. So, in addition to the school liaison, I'll be there as well. Did want to mention some work that I'm doing with Hendrickson and Dr. Poe. We are discussing some new strategies for math improvement for grades 7 through 12. We're looking at potentially some new courses at the high school. We also run some SAT classes that in the past have been taught by teachers. We're looking to make those co-taught also by students. So together that time.
Would there be a process for getting certified to be the student teacher then?
I don't think we have a process, just a volunteer. And it's just for those specific, like after school, giving sessions of classes. And last thing, in addition to being on this board, I'm also on the State Student Advisory Council on Education. So we had our first meeting, I think it was last week, yes, last week. And we're focusing on best practices around distance learning and also building a school community across.
Thank you, Irishman. I'm very interested in hearing about more about the work that you're doing on that committee. So as you have information to share, you don't have to wait for this meeting. By all means, report it, but share it through Scott and the board, and I certainly will be very interested in reading. I'm sure the board members will be as well. Thank you for representing us on that statewide committee. Any questions, comments for you? Okay. Hearing none. Action items. Who'd like to begin with some motions?
May I move the acceptance of personal retirement request of Victor Casado, custodian at Ellington Middle School, effective November 1.
Seconded by Jen. Any discussion? All those in favor, please signify by saying aye. Aye. Opposed, say nay. Any abstentions? Passes. Number 2.
Move that the Board of Education accepts with regret and best wishes the retirement request of Don custodian in Ellington Middle School effective October 30th, 2020.
Second.
It was close. I think it was seconded by Jen. Any discussion? Hearing none. All those in favor signify by saying aye. Opposed, say nay. Any abstentions? It passes. And any old business, new business, Scott? Jen? Jen?
I actually do. If we can get not over new business, but maybe this is round table. But can we get a list of committee dates for all the committees that we have? Because there's nothing on the internet right now. There's nothing on the website. And for some reason, I don't have all the dates for all 5.
Didn't we have a master Google
We used to.
Yeah, we did.
sheet of those?
But then everything moved around quite a bit.
Thanks, Jen.
I can share that document too, John.
Okay, so that just needs an updating?
It's updated every KK plan. We have everything planned through December, so we need the plan now starting for
Okay, so it is.
I'll reshare the document there once we
That's good, thank you.
Okay, wonderful. Thank you. Mike, on the bottom of this last page, of the upcoming dates of interest, and Gary was on to the curriculum meetings and communication. Will they be here or at the Board of Ed?
Here.
Don't we know yet?
Yeah, we're still here. Just easier to spread out for now.
Curriculum for is here.
Yep. Thank you. Anything else?
I'd like to say something about the motions that we didn't do. But our first motion regarding the hybrid model, we move that the Board of Education endorse the hybrid model as presented and then revisit it the week of September 8th. And then on the 23rd, we did have a possible motion. And because of that, I did receive a lot of calls about what did you ever vote? What did you decide? And I know it's not saying that it's a possible motion, that's what it said, but I think we should have followed through with that.
And I think we did, and we voted once, Scott had put that on the agenda as a possible, almost like a second endorsement. It wasn't necessary. And so, I think we addressed that effectively, but if Liz is getting calls, maybe we just need to put some clarification out, Scott. Or Chris, go ahead.
I got a lot of texts and messages and calls as well. And that original motion, it said that we would reevaluate the week of September 28th and then, basically make a decision or whatever. So that was within the motion and that didn't happen. So, I mean, we talked about it and everything the week before, the 28th, and a second vote never happened, which that's fine. I know that's not something that we even, really needed to vote on because it's not really within our jurisdiction per se. It was more of an endorsement. But that being said, the motion did read that we would reevaluate the 28th. So if you're going back to that motion, things didn't happen according to that motion.
Yeah, so I mean, I don't want to split hairs on it, but I think they did to a degree, but you could look at it and say we needed to re-vote on it and the motion ended on that date. I looked at it as very differently that we voted on it, we revisited it several times in multiple forms, and we wanted to continue with the plan as it was originally voted on, so there was no need to re-vote on it again. But I totally understand how it caused some confusion. And I think, Scott, we've been putting out communications, you've been putting out communications to the parents every week. That's something the board had requested. And if board members are still getting calls, I got calls on that too, by the way. It was confusing.
It was right after that.
People thought we did it like.
Yeah, people were expecting a
in
motion.
executive
Yeah.
session. I'm like, we couldn't even do that in executive session if we wanted to. I'm like,
Yeah.
no, it didn't
Well, like
happen.
anything else, Chris, people read the agenda, they see it on the agenda, there was no vote, they're looking at the minutes and they think, oh my God, there's been a
I
major
missed
change in something. So I got the questions on that too, but fortunately, I think we've put out a lot of good communication from the superintendent's office and it's gone down, but I think, lesson learned, and I think we could address if there's any additional questions, any specific individuals that are calling, I'm sure Scott would like to know about it, and then, he could work with you and the people calling to make sure the right information is getting out there. Anything you want to add to that, Scott?
No.
Okay. Anything else?
I have something for.
Please, Chris.
I guess it would be old business, new business, I don't know, but, at some point, I'd like to talk about what the nurses brought up. It's not on the agenda tonight, obviously it won't be tonight, but whether or not, having like a full-time if we could even fill it, but like a full-time or part-time sub-nurse position to then help when we need to do contact tracing, things like that. Obviously the PPE or whatever, that's Brian's thing. But I think it needs to be addressed. I don't want it to just, we heard it and then move on. I really think we're going to need to, discuss it and do everything we can to help out their situation.
Yeah, thank you, Chris, for that support. And I made it explicitly clear. I gave them my word that we would be helping them, and that's why I asked if they needed anything. So my plan is to follow up with the superintendent. We talk frequently, daily.
I think Brian can address it now.
Yeah, well, I will say, Christy and I have been, Dr. LaPorte and I have been batting around a couple ideas in order to get an additional nurse in. We have gotten a couple more subs on the list. Even as recently like yesterday, we got another potential. So we are pounding the pavement trying to get.
Are you talking about floating, like a floating substitute?
Well, just first, the sub pool in general needs to be addressed. But also we've talked about, a floating sub either, a few days a week or full time so that we can, stretch the dollars as far as we can.
Yep.
So we have been batting around those. I think part of the thing is we just need to identify the talent before we can make a commitment on one of those things. And so I will follow up. I'll follow up with her tomorrow.
Good. And Scott, we'll talk about that too. I'm expecting action on it. I'm sure you guys are working on it.
And on PP&E as well. This is the first time I'm hearing of a real shortage. So I'll start pounding the pavement tomorrow. We were able to get some through the fire department earlier in the year when we were looking for a specific type of mask. And so it's possible that we might be able to partner with our town agencies
Yeah, definitely, I mean, that's gonna be part of my conversation with Scott, you know, talk to Joe Powell, he has access, he can put a tasker into state, Homeland Security, you know, they still have, potentially still have, the medical grade latex-free gloves or whatever the nurses are looking for, and then there's other sources too, so I'll share some of my experiences with you guys as well. I mean, I'm able to get them, if I can get them, you can get them, you know, so we'll work together. Anything else, Chris, you want to add?
No, that's it.
No.
Okay. Okay, any other comments, questions, note, old business, new business? Anything on correspondence, Jen? Scott? Nothing received?
Can I just say,
Please, Chris.
I got an email, and I don't even know where I go about finding this information or whatever, but I believe you also got an email about it, but somebody, it was about that, she's a member of the ad hoc committee, I believe, and she's looking for, demographic information.
I thought
regarding
that
our
information
staff.
would be on the ed site.
Oh,
I couldn't find it anywhere when I was
All right,
looking
hold
for
on,
it,
one at a time.
So the-
So Chris,
the-
Mike, did you want to add anything to that? No, go ahead, Scott.
The committee had not even have met once. It was not something that, when I met with the person personally and talked about getting information when the committee wants it and being able to present it to our liaison. And so we were, so this was just someone going above and beyond, trying to have a bunch of information that wasn't going to even be discussed at the first meeting. So we're working through that, and what I had mentioned is, if we're gonna be presenting to the ad hoc diversity committee on employee information that is different stats and different things, we would present it in a comprehensive way, in a context, so they would have all the information that they need, not just a few stats that would just be given, that would take things out of context.
That's what I was saying.
Right, so I met personally with the person, and of course corresponded with, email, and, the committee hasn't even set any goals yet. The committee's trying to work on a mission statement. They said they want to work on a mission statement, so that's where they're at. They haven't even set up a board of directors yet. And their first meeting had a lot of technical difficulties where they had people on Zoom and in person, and they could not hear one another, so they had a translator. So they just got to get going a little bit and then figure out what they need and what they want, and we can support them really well. The person wasn't acting on behalf of the committee at all at that point in time.
Right, but isn't that stuff in the State Department of Ed site database? Like breakdown of faculty by
Try and find it.
subcategories?
Because I was.
Asian, Black, I'm pretty sure that's part of the ed site.
Yeah, I don't know how to access that particular way, just, it may be for teachers, maybe for certified staff.
Yeah,
But
and this was, she was asking about the entirety of the.
it wasn't abundantly clear.
It is there for teachers.
It wasn't abundantly clear what was being asked. We were trying to work through that.
I thought about it responding, but maybe it could have been.
I think we have a liaison that's gonna do a great job. We're going to work with the town committee, help them, support them, provide them information that will be helpful. Remember, the ad hoc diversity committee is not a committee formed to do the equity work of the school district. The board oversees the equity work of the school district. That doesn't mean that we're not partners, we're not supporting, we're not helping do different things. But that the role of that committee is to work on the diversity and equity issues of the town. And the school district, obviously being part of the town, is an important partner and can support, help them do that work really well. And we're laying the groundwork of trying to figure out what they want to focus on, how they want to focus on it. They're just really getting going, and they're meeting once a month. So this is going to be a very slow movement of the committee.
Thank you. All right. Roundtable. Anyone else like to add anything? Very good. And we have executive session. Someone like to make a motion, please?
Move to enter into executive session to discuss contract negotiations and invite the following people to attend: Dr. Nicole, Superintendent of Schools, and Mr. Brian Mooney, Director of Finance and Operations.
Second.
Seconded by Miriam. Any discussion? All in favor, signify by saying aye.
Aye.
Opposed, say nay. You say nay?
No.
Oh,
If I say, do we have gone to executive?
And any abstentions? We are now in executive session. John, give us the green light.
He has to, we can vote if he stays all night.
Mark, we'll see you. Thanks.
Thanks, Mark.
Just wondering more about.
Thanks for hanging out with us, Mark.
Fair enough.
Yeah, Chris, we gotta do something for the nurses. That's easy stuff, you know?
Did they order that?
Yeah, absolutely. And like, you get